afternoon, good morning, good evening, good afternoon to all friends all over the world. It is the monthly Mentors HMV webinar, his or her memories and views, where we interview two very distinguished neurosurgeons who have contributed significantly to our discipline from all over the world. And this is the sixth in the series now. We have one every month on the first Friday every month. So it's my distinct pleasure to introduce you today's mentors and our distinguished panelists who will be interviewing them. We have my dear friend for many years, I don't know how many, Professor Yang Kwang Tu from Taipei. Professor Tu, as any neurosurgeon would know, he has been the president of the World Federation of Neurosurgical Society and continues as the honorary president of WFNS. He has been the president of the Asian Australasian Society of Neurological Surgeons and continues as the honorary president. He is currently the president of Taiwan Neurosurgical Institute, Taipei Medical University, the professor emeritus at the prestigious National Taiwan University. Now he will be interviewed by our dear friend and the president of our Continental Society, AASNS, Professor Wan Tu So, who is a senior consultant, Department of Neurosurgery, National Neurosciences Institute, Singapore. Dr. Wan Tu So has already contributed once, I think last or 1 month before that. So he will be repeated here. And then we have our own Professor Mr. R.P. Sengupta, Indian origin, British neurosurgeon, very distinguished neurosurgeon, mentor to many, including me. He is the head of neurosurgery, chairman and managing director of the Institute of Neurosciences, Kolkata, which is actually his brainchild and his baby, who he has done it. He has developed this institute, one of the premier institutes in India today. And he is also the emeritus consultant neurosurgeon at Newcastle upon Tyne. He is visiting professor neurosurgery at Ramachandra TN University, Chennai, India. Mr. Sengupta, as many of you will know, was one of the pioneer aneurysm surgeon, vascular surgeon of the world, one of the first leading neurosurgeons from whom many of us got trained. He will be interviewed by Professor Pragnesh Bhatt, again, our very dear friend from India, who is currently the consultant neurosurgeon and honorary senior lecturer at NHS, Grampian. He is Aberdeen Royal Infirmary, Scotland. He is of University of Aberdeen. He is also the University of Aberdeen Foundation Program Director, NES, and Regional Director of Scotland. So without wasting time, may I invite my dear friend Wan Tu, please take over and ask your questions to Yong Kwang.
Okay, thank you so much, Basan. It's really a pleasure to be here again tonight. And I have the honor of actually interviewing also a fellow mentor of mine, Professor Tu. Let me just quickly run through the CV so that you know what his achievements are. So he completed his medical school at National Taiwan University in 1976, completed his neurosurgical residency at the National Taiwan University Hospital, 1981. Then he became a neurosurgical fellow under Professor Roberto's heroes at Massachusetts General Hospital and Harvard Medical School until 1988, completed his PhD in 1989. Then following his fellowship in the US, he returned to his alma mater and he rose in rank from associate professor in 1989 to professor in 1998, chairman of the Department of Neurosurgery at NTU in 2004, and then when he retired as a professor emeritus in 2013. Then he went on to become chair professor at Catholic Fujian University and chair professor, College of Medicine, Taipei Medical University in 2016, which is the position he currently holds. So in organized neurosurgery, he was president of Taiwan Stroke Society, president of the Asian Oceania Society for Skull-Base Surgery, founding president of the Taiwan Society for Skull-Base Society, president of the Taiwan Neurosurgical Society, president of the Asian Oscillation Society of Neurological Surgeons, and president of the World Federation of Neurosurgical Societies from 2013 to 2017. So that was a wonderful achievement, Professor Tu. So perhaps tell us a bit about your early career. Who were your mentors along your journey? Who influenced your neurosurgical practice?
Thank you, Wan Chu. I'm going to tell my own story a little bit. As you mentioned, I graduated from the medical school of National Taiwan University during the mid-70s of the last century. So at the very beginning, I spent a year in internal medicine, but then I decided to go for surgery. So I applied for the surgical resident program at the university hospital. At that time, although other neurosurgical training programs of the country already started the current 6-year program, but the National University, as the oldest university, was still very reluctant to change its program and use a very strange old system that all the surgical disciplines are under a big surgical department. And the residents rotate to these different fields for 3 or 4 years until the last year, they fixed in a specific field and became a specialist of that particular field after a year of training. So I consider that kind of training was incomplete. So therefore, but I think I need to go back a little bit. Before the last year of training, we need to make a decision.
Can you see Yong Kwang? I can't see him now.
You can see me?
We can see him, but his video is frozen a bit.
I can't see your face. Yeah, now I can see you. That's right.
Oh, it's okay. Okay. Yeah. So after 3 years of rotation in general surgery and different fields of surgery, I faced the moment of choosing a specialty as my future career. So initially, I was very interested in cardiovascular surgery. But my father was a general surgeon, so I saw that he probably wanted me to follow his steps to become a general surgeon. Therefore, I tried to discuss with him on this matter. Surprisingly, he told me, go for neurosurgery. But at that time, neurosurgery has a very high morbidity and mortality because of very poor diagnostic tool. So I told my father that my performance at the first 3 years was not too bad. So there's a very high possibility for me to choose other field, which I like. But he told me no, neurosurgery will be different because at that year, we obtained our first CT scanner at our university. So he said that after the CT scanner, the diagnosis will be better and the treatment effect will be improved. So I follow his idea. That's why I became a neurosurgeon. So this is the first part of my career.
And then yes, carry on.
Yeah. And then after finish my training, I feel that my training was incomplete because only 1 year real neurosurgical training. Although at that particular year, I did many surgeries, but many other knowledge I do not have, I did not obtain from my training. So I decided to go abroad.
So that was
talking
when
about
you went for your fellowship.
My mentor. You were asking about my mentor.
Yes.
In my journey in neurosurgery, I have many mentors to learn from. When I was a young resident, of course, I learned basic knowledge of neurology and neurosurgery from our faculty members in the neurosurgical service of my university. But the one who had the most influence on me is the late Professor Chin Zhang Hong. Professor Hong, he was the chief of the service at the university hospital, and he was also one of the past president of AASNS.
Right. Yes.
He's a very intelligent person with incredible memory capability. He speaks 5 different languages fluently and very knowledgeable in history and liberal art. But interestingly, he did not like to perform neurosurgery on his own. So in my 1 year of chief residency, he allowed me to perform surgery for all his patients. Under his supervision, I operated on 108 patients harboring various types of brain tumor. So that was an incredible record for a chief resident. And to me, this experience was very precious for establishing confidence in doing brain surgery and very helpful for my later development in neurosurgery. He was the first person who opened the door of neurosurgery for me. Later, there are two international neurosurgical masters who have made profound influence on my neurosurgical practice. My first international mentor in neurosurgery is Professor Roberto. After I finished my neurosurgical training at the National University, I felt that my one-year training in neurosurgery was insufficient and decided to find a way to enhance my knowledge and skill in neurosurgery. I also want to choose cerebral vascular surgery to be my specialty in neurosurgery. Therefore, I applied to be a fellow at Massachusetts General Hospital and Harvard Medical School under the supervision of Professor Hellos. Initially, I only planned to be there for a year to do some research in cerebral vascular surgery. Dr. Hellos was very kind to allow me to shadow him in his clinical work. So I observed and participated in his surgery. I also took part in all the clinical rounds and conferences. He helped me to obtain the 3-year scholarship and a faculty position in Harvard Medical School. So finally, I was able to stay in Boston for 4 years. In those 4 years, I learned many important concepts concerning neurosurgery and cerebral vascular surgery, as well as the attitude of how to behave as a good physician from Professor Hellos. Professor Hellos is a very honest gentleman. He frankly discussed all his complications and emphasized his mistakes that young trainees may avoid. I will never forget that in many nights, I ordered his AVM surgery until,
yes. Your video is frozen.
I don't know what is the problem. I'm sorry about this.
Now it's okay. Now it's okay.
Okay.
Yeah.
Okay.
Yeah, carry on.
So in many nights, I ordered his AVM surgery until midnight. At that time, he must be very exhausted after more than 12 hours of surgery. Yet he was trying to explain all the details of dealing with that devastating lesions, and he tried to take care of me whenever I need help, even till now. He's the one who makes the most influence on me. My other international mentor in neurosurgery is Professor Maji Sami of Germany. Although I never had an opportunity to be trained with him in Hanover, I learned many things concerning skull-base surgery from him through personal discussion and attending various congresses. I took cerebral vascular surgery as my subspecialty initially, but later on I realized that skull-base anatomy and surgical approaches are similar to cerebral vascular surgery. Therefore, I picked up skull-base surgery as my subspecialty as well when I returned home from Boston, and became the first few neurosurgeons who performed skull-base surgery in Taiwan. At that time, skull-base surgery was booming, and I participated in international conferences and symposiums extensively and get to know Professor Sami. Progressively, we developed a very tight connection. To me, he's not only a mentor in skull-base surgery, but also an inspiration in many aspects of neurosurgery. He brought me into the international arena of neurosurgery, and because of him, I started to be involved in the affairs of World Federation of Neurosurgical Societies. He was a person to encourage me to run for the campaign for the presidency of the WFNS. After I became the president of WFNS, I collaborated with him to promote and do fundraising for one of his most important initiatives for world neurosurgery, the African 100 project, a project that aimed at the training of 100 neurosurgeons over a period of 10 years for continental Africa, where numbers of neurosurgeons and standards of neurosurgical practice is far behind the needs. So that's why I got to know Professor Sami and why I take him as one of my mentors.
Okay, so thank you for that. So now, after you returned back from the US, you started your neurosurgery career, you became professor, you became chair of the Department of Neurosurgery at the National Taiwan University, and you were very well regarded, very well respected. Now, what advice would you give for neurosurgeons who have leadership potential and even current leaders in neurosurgery as to how to manage their department well? I think we hear a lot about, heads of departments who are very good, and then we hear about some who, could be better. And maybe what advice would you give based on your own experience?
From my point of view, the university department has three important missions. Number one, of course, is education for the next generation of physicians or surgeons. Number two is to conduct research to solve problems and unmet needs in clinical medicine. And number three, to improve standards of clinical practice. Therefore, a leader of a clinical department at the university needs to have several characteristics. He needs to be capable in promoting education and research, and he must be a good teacher and a good researcher. He also needs to have the ability in doing good clinical practice. He must be an eminent clinician. I know many universities select their chief according to their publication, and some of them are not even doing any surgery or clinical practice. And this kind of leader will not be able to lead a good department. In addition to these three characteristics, a good leader needs to have a good vision for the future for his department or her department. And so he needs to have a good idea about where he wants to bring the department to. He needs to have a potential in collaborating with other departments and organizations. A good leader must be a good coordinator. The other thing important is a good capability to manage finance of the department, obtain budget, and perform fundraising are important for the department's development. And he needs to be able to identify and cultivate potential successor for the future of the department. So this is my point of view. A good leader needs to have those characteristics.
Okay.
So, yeah.
Check your video again, Yang Kwang. In between your, I don't know why the video
I don't
becomes
know. I think the problem is the internet.
Yeah.
Oh, okay. Now it's come now again. Yeah. Sometimes it goes. Go ahead, please.
Yeah. One question, a bit just came to my mind is, now how do you select future neurosurgeons? I mean, it's something that, all of us has had a leadership position sometimes have to do that because, who's going to be our trainee and all that. Any special advice for leaders as well?
You mean select a leader?
No, select trainees.
Select trainee. Well, this is a difficult question because every year we need to select 2 or 3 trainees into our department. So usually I try to talk with them, very long conversation, and try to find whether is this person honest, is this person ambitious, and is this person hard work, doing hard work.
Right. So
I try to ask this person several different questions to identify those characteristics.
Okay.
So, but very difficult still.
Yes, that's why your advice is important. Okay, one more question. Now, you became president of World Federation of Neurosurgical Societies in 2013. Now, what advice would you give to neurosurgeons who are interested in organized neurosurgery? In other words, the societies and all that.
For neurosurgeons who are interested in organized neurosurgery,
yes,
I would like to encourage them to participate in more international activities.
Yes,
and take responsibilities for international affairs.
Mm-hmm.
However, only active participation is not enough. You need to have some academic achievement to obtain respect from your colleagues. So try to make presentation in your clinical research, the presentation of your clinical and research results in international conferences. Accordingly, people will select you for the important position in the organization, and progressively you will promote to a certain level in an organization.
But I just want to add on here, Yong Kwang too was not only the leader, but he was primarily involved in resurrecting, let me put it this way, or the adding to the education activities in our continent, the Asian Australasian, much before he became the president of the World Federation. He was the, as you know, he was the president. I think he was this, you were still the secretary for a very, very long time, and you were the secretary with him.
I was his secretary, yes.
Yeah, 2007, if I'm right, he took over as the president of ASNS at 2007 to 2011. He was the president of the ASNS. And one of the first things I remember he did is called me and said, Basant, we should have education programs. And he said, why don't you take over that responsibility? So I distinctly remember one of the first acts he did was to have an educational committee. And so we started off,
Yes.
You remember, you were very much
absolutely.
there.
Absolutely.
So, and then from him, Andrew K took over, and we have never stopped doing that. So thank you, Yong Kwang, for starting.
I have to thank you because of you. Because of you, we achieved so many things.
Yeah, I mean, I was his secretary for 4 years when he was the president. So we had a beautiful time because we had a very good rapport. And I was lucky because he trusted me, with his complete trust. So we could manage to do a lot of things without any confusion, any conflict. I mean, our views matched so beautifully. And let me put it this way, another thing which Yong Kwang has contributed, he didn't tell that, but he is the gentleman who has contributed to the World Federation the highest, not only in the programs, but the financial stability of WFNS today is partly or primarily responsible because of Yong Kwang too, because he is such a powerful leader in his own country that his friend committed $500,000, or was it $1 million? How much was it?
$500,000.
$500,000 to the World Federation, and it's still he's doing in installments, and he has already donated that, which has gone to this Africa 100 Fund and other activities of the WFNS and WFNS Foundation. So I tell in many of our interactions in the WFNS, I said, see, the guy who really kind of did something, who donated, people do, a lot of people talk, but he managed, I mean, not only, you can understand how powerful he is, that his friend committed without any kind of getting anything back in return, 500,000, just like that. And not only that, he was also, I think, he's very powerful in his own country because he's very highly respected. I remember once I was in Japan for a meeting which he also organized. He also organized many meetings, very successful, including the ASCNS and the AOSBS, the Asian Oceanian Skull-Base Surgery meeting, which both of us, of course, I have attended. But he had also, and some other meetings which I have also gone many times to Taipei, thanks to Yong Kwang. But there was another meeting, I can't remember which one was that, but there was a meeting which he was organizing, which he had invited. I was very happy to go. But I was in Japan, and there was a meeting in Tokyo. Takashi Kawase was organizing, which I was in that meeting, and I was supposed to go from that meeting to Taipei's meeting, which I had no visa. So he actually called me up. He said, I will get you a visa. Don't worry. You come in, just come in and have your visa. So he is not only a very, very distinguished neurosurgeon, he is a very, very powerful man in this continent and in his country. Very, very highly respected guy.
I can attest to that because I was his secretary, and the AASNS changed and became one of a much stronger society. But now let's go back now to our interview. Probably the last question. Okay,
I'd like to thank you, Basan, for those nice words. Thank you.
No, I enjoyed the journey with you, Yong Kwang. It's been such a pleasure and privilege.
And now we need to talk a bit about the future. What do you think are the biggest challenge for neurosurgery today? Because you are right in the middle of it. What's your opinion about, and advice you want to give to the next generation of neurosurgeons?
For the next generation of neurosurgeon?
Biggest challenge for neurosurgery, and and what kind of advice would you want to give to the next generation of neurosurgeons that are joining us?
Well, for the young neurosurgeon, I think they need to overcome all the challenges that we have now. So we have several different situations in the world, and we have several different challenges which we are facing too. The first that now we are facing in an era of rapid expansion of knowledge and information. So to practice neurosurgery, we need to cooperate with many devices of high technology. Therefore, neurosurgeons need to have a broad spectrum of knowledge in various aspects of science. We probably need to extend the length of neurosurgery training and reorganize the content of our training curriculum for young neurosurgeons. Can you hear me?
Yes, we can.
So the other challenge we have is there is a very large discrepancy in the geographic contribution of neurosurgeons in developing countries. One neurosurgeon is serving several million of people in developing countries. On the other hand, in some regions, neurosurgeons are overproduced. So they have the result is they are serving a very low patient volume, and consequently, the experience of young neurosurgeons will become insufficient. Or some neurosurgeons, they will perform unnecessary operation. So we need to avoid these situations. So how to make a good balance among the numbers of neurosurgeons in the world will be a critical issue for us to face.
Right.
So for the next generation, my advice is compared with other disciplines of medicine, history of neurosurgery is rather short, and there are many unknown to be explored and to discover in the field of clinical neuroscience. So probably because of this reason, many brilliant and ambitious young neurosurgeons, young medical graduates want to devote themselves to this field and choose neurosurgery as their future career. So we should try our best to educate and encourage this new generation of neurosurgeons. There will be the hope of innovation and sustainability of neurosurgery for the future. So we need to help those young neurosurgeons to educate them and to have a better future for all of us.
Okay, great. Thank you. Okay, final question. Now,
Okay.
if you had a chance to do things all over again, what would you do?
Well, if I have something like if I were the freshman again, what should I do? If you ask me if I can do things over again, I think my answer would be I will work harder, prepare myself better, and learn more seriously to enable myself to achieve a better treatment result in all my patients. So I think this is my goal in my life, and I didn't do it well. If I can do it once again, I will do it harder and better.
Right. Okay. So, Hasan?
Yeah, thank you. I don't think he can work harder. I think he works about 18 to 20 hours a day. I don't know how can he work harder. But anyway, that's the guy. That's a workaholic like many of us.
It's a dream.
So thank you very much, Yong Kwang. And we will now invite Mr. Robin Sengupta. And by the way, Mr. Sengupta was given the Medal of Honor, by a WFNS Medal of Honor by Professor Yong Kwang Tu, the president of the World Federation. So it is indeed a right combination that I thought we'll have the Medal of Honor awardee and the person who gave the award, Yong Kwang Tu, in the same platform. So it's my distinct pleasure to invite now. Thank you, Yong Kwang. We will now have the interaction with Mr. Robin Sengupta. And let me invite my good friend Mr. Pragnesh Bhatt, consultant neurosurgeon in UK, to please interview Mr. Robin Sengupta. Some of the Indian or people who are outside Britain would may not know. Most people know that the surgeons in UK are called Mr. That's why I'm saying Mr. Yeah, go ahead.
Thank you very much, Professor Misra, for giving this opportunity, which I would consider a privilege to interact with the master, as we call Professor Sengupta. I go a long way. When I was a trainee in Mumbai, I was first introduced to Professor Sengupta in '85 when my teacher, late Professor Bhagwati, had invited him, and he was operating at the JJ Hospital, clipping an aneurysm. And we all were awestruck about his dexterity and the mastery of clipping aneurysms. We will have a lot of discussion about that. But before I go on to that further, this was my introduction to Professor Sengupta, and I always been his student indirectly, though I haven't had a benefit of direct training. But Professor Sengupta acted as a bridge and a gateway to most of the Indian neurosurgeons who came for training in Britain. And I'm one of them as well, indirectly. Professor Sengupta has a very illustrious CV, and I don't want to dwell too much time on that, otherwise he will not have time to speak enough. But just to highlight that after a very distinguished career in medical school in Kolkata, having qualified in '61, he moved to Britain, and I'm going to ask that question first when I finish this introduction about his achievements. He subsequently trained in Britain, became a fully qualified neurosurgeon in '76, was appointed as a consultant neurosurgeon in Newcastle upon Tyne in '78, subsequently rose to the chair, departmental head in '92, which he continued till he retired officially in 2002. He is currently emeritus professor. There are many achievements. He has been a visiting professor all over the world. He was a frequent flyer. I think he has, he possibly could have chartered a higher plane, then it would have been more economical, the trips he has made to the world and mainly to India. He still goes regularly to India. I know his heart is in India, though his body is currently in Britain. He also got a doctorate of medicine from the University of Newcastle, which is the highest honor someone is given in 2016. And as Professor Misra mentioned, he also received a Medal of Honor from WFNS in 2017 in Istanbul. And I have a picture with him, which was my most precious possession. I also admire Professor Sengupta for creating an institute of national excellence in his hometown, Kolkata. According to Indian philosophy, we have got three types of depths: depth of motherland, depth of teachers, and depth of parents. And he has fulfilled all those in various ways. But the one I'm quoting is about his full construction of this institute in Kolkata, which I'm sure he will talk about. So without further ado, Professor Sengupta, if I may first start with a question, that having qualified in Kolkata in 1961, tell us something about your move to Britain and your career, initial part of your training and your move to Boston. Please highlight us. Thank you.
Well, good morning from Britain to you. After hearing my friend, Professor Tu, I feel that I'm probably a kind of a misfit. He has done so much and I have very little to tell. But as Basan very kindly took me as to talk something about this program, and your question was, why did I, immediately after qualifying the medical qualification, I decided to come to Britain. All these are different kind of personal story because in those days that I was always ambitious to become a big surgeon. That I came from, got the idea from childhood that I wanted to be a surgeon and a big surgeon. And so if you do qualify graduation, you just only enter into the specialty profession. But in those days, you have got to have the money to go to a full-time medical postgraduate education. And I did not have that money, but I came to know that if you come to Britain, not only that you can work in the National Health Service, but also you can do your specialization in surgery at the same time and get the Royal College fellowship. So that attracted me. And so that is why I decided, without any postgraduate qualification or training, I decided to come to Britain. And that was the reason for I came so early to Britain.
Thank you very much. Now, after your initial training in Britain, you work with masters. I heard your talks on your thesis on ACOM aneurysms and the morphology of various types of ACOM configuration. And I believe you work with Professor, as you call, Bob Ogerman in Boston. Tell us something about those who influenced your early career in neurosurgery.
Yes, well, I just had initially I came to Britain, and it was in those days very difficult to get a job very difficult to get a job in this country because the number of total neurosurgeons in the whole country was only 100. So somebody, neurosurgeon, will have to die before another neurosurgeon is appointed. However, but the thing is that when I started to get difficult to get a job, so I would take any job that come to my hand. And also I had to get my registration. And so after quite a bit of a struggle, I found a job in Manchester. Manchester, I got a job to do, near Manchester rather, to do my registration. After registration, again, looking for a job, next I found a job in Newcastle upon Tyne, which is very, very north part of England. And so there I came to do a job in the accident and emergency, which was not very popular in those days. Popular specialty were general surgery or medicine or gynecology. But as there was a very difficult to get a job, so I took a job, whatever is available to me, and it was a casualty job. And casual accident and emergency, I did it for about a year. And then I got a job in orthopedic surgery. But I did not like orthopedic surgery because my ambition was always to do general surgery or surgery. But I had no clue about neurosurgery because what is neurosurgery? We did not have any idea except the thought of head injury, extradural hemorrhage, and that's it. As Professor Tu said, there was a proverb in our country, in Calcutta in those days, that patient goes for surgery and they never come back alive. So therefore, neurosurgery was not something that was in anybody's mind to become a specialist. So when I was doing orthopedic surgery, I did not like orthopedic surgery at all, but it was very difficult to get any job. So somebody suggested that in neurosurgery, in the same hospital, Newcastle General Hospital, they cannot find a neurosurgical trainee, neurosurgical junior resident. And so if you are, I said, neurosurgery resident, no way, I cannot, I have no idea about neurosurgery, I cannot do anything. But again, because I had to find a job, and I could not find a general surgery job, which was my target. And I was more or less forced myself to do a locum. I promised myself I do for a few months and then look for another job and then leave. They are also desperate to find some junior doctor to do the junior doctor's work. So I went in neurosurgery and I was very, initially very difficult. But I will tell you one thing, in England, in the UK, whether England, Scotland, or anywhere, the nursing staff are so experienced, and so they are so good. Almost, I could say that my initial post-graduating experience, I learned from the nurses. The nurses were very good, and so in fact, the nurses, I became very friendly with the nurses because all my weakness, they covered up for me because I did not want to expose to the consultants that I did not know this, I did not know how to do EKG, I did not know how to do lumbar puncture, this sort of thing. They said that don't worry, and they changed my name to Robin. My name was actually different, Ram Prasad, and they said that we will call you Robin. And then since that, all over the world, I became known as Robin. Anyway, after that, I took neurosurgery. When I went to see the operation and other things, I was amazed to see how the neurosurgeon opening the brain and handling the various parts of the brain, like a frontal lobe, going to the base of the brain and all the fissures and gyri and cerebellum, and all these things amazed me. I said that, my God, this is the beauty of this brain, is almost like a beauty of the so many pictures. So I said that, and what they are doing, and sometimes the patient become after operation, I must have to say, after acoustic neuroma operation, I saw them, they were very beautiful face. After that, they became very twisted face. And there was a personality change and all these sort of things. And the other way around, I say that by handling brain, you can create a different thing, either for the better or for the worse. So I say that this is the thing that probably I've never seen before in any other surgery. So I just started to get idea in my head that I want to be a neurosurgeon. So I said to them, they were not finding a junior doctor. I said that if you don't mind, I want to continue. So that was the seed of neurosurgery came into my head after seeing the brain surgical operations and also seeing, and the neurosurgeons are very, I must have to say that they are very simpleton people because they have no time to go into kind of a hospital politics or anything else. They are very friendly. And because they know that they sometimes lose their temper in the theater, but as soon as they come out of the theater, they embrace you, they take you to the restaurant, the consultants. So I thought that they are very friendly people basically, but when they go to the theater, they have got nothing but thought in their mind apart from the patient. So that's impressed me to become a neurosurgeon.
Thank you very much. I echo your sentiment. I was also taught by one of your greatest friends, Professor Guru Singh, who used to say that enter the theater as if you are entering the temple. So absolutely right. Now you excelled into vascular neurosurgery, especially clipping of aneurysms. You were worshipped all over the world, and mainly in Britain and India. There were lots of invitations for you to teach and operate. Tell us something about your interest in aneurysm surgery. How did you manage to excel, and what do you think about it? And then there is a question which I will follow subsequently. So please expand on aneurysm.
Why I became interested in aneurysm surgery. Right. Please. You see, when I was doing training in Newcastle General Hospital, there was a period when I thought of, I went to Birmingham to do another registrar job, because in this country, UK, there is in those days, there was nothing like today that you have got a total 5 years of training period or 6 years. In those days, you have got to be first of all a house officer, after the senior house officer, and then the registrar, and then the senior registrar, and then the consultant. And so when you are every position, there is a period that you can be only senior house officer for maximum of 2 years, or registrar for maximum of 2 years or 3 years. Then either you have got a job, senior job, or you have got to leave. So there was no program at all. Very difficult time in those days. So I had to leave Newcastle General Hospital while I was doing neurosurgery. So I had to take up another job in Birmingham. When I went to Birmingham, I was working with 3 Birmingham Queen Elizabeth Hospital. That was a smaller hospital than there was another big hospital in those days. So there were 3 consultants, and one is called Jack Small, another is Brodie Hughes, another is Eric Turner. These 3 consultants that I had to work for, and I found that the 3 of them have got a completely different approach to aneurysm surgery. When in one, Professor Brodie Hughes, when there was a patient come in, he was always interested in other things, but not in vascular surgery. He always would transfer the case to another neurosurgeon. So he was not interested. And then there was another consultant, Eric Turner. He knew that if you operate in a cool state, that results are better. So he leaves the patients at least 3 weeks and he will not touch them. And during those 3 weeks, I saw that a lot of patients were dying in the ward that I was looking after with a rib bleed. And there was another neurosurgeon called Jack Small. And Jack Small was like a tiger. He would come, his patients, he would take to the, I'm talking about in 1967, 68. And he would take the patient to the theater and ask the cardiac surgeon to close the heart. And then he will clip the aneurysm very quickly. And then they will restart the heart. So, and his patients were going home within 10 or 12 days, whereas other neurosurgeons patients were dying in the ward for lack of operation. Or if they operate, the results were not that good. So that impressed me, the aggressiveness of approaching a difficult problem and how doing it, that appealed to me. I said that this is the branch of neurosurgery that is exciting, that you take the issue, take the problem on hand very quickly and solve it. No need to delay it for another day. So that is what. So when I got a senior registrar job back in Newcastle upon Tyne from Birmingham, then I was working with a neurosurgeon. He was almost returned from the army. And so he was very easygoing consultant and senior most consultant. So I was given to work with him in rotation. So when I was working with him, he allowed me to do whatever surgery I can do if it is well done. So what I learned from Birmingham, aneurysm surgery, I started to do it in Newcastle. And in Newcastle, also there was an old-fashioned period of wait for the, in those days, wait for the period, and also for aneurysm, they would do proximal ligation rather than direct surgery, because the direct surgery carried a lot of risk. So, but I saw the direct surgery, what need to be done in Birmingham. So when I came to Newcastle, I started to do direct surgery. After doing that, I became very, very popular. I was a senior registrar, I was not a consultant, but my consultant allowed me to do those cases, although people by name, it was under my consultant, but actually I was doing the surgery. but the hospital neurologist recognized that my patients are doing very well after aneurysm surgery. And at that time, I was very fortunate to have an anesthetist. His name is, he was very, very kind. He knew that I was an Indian, and for an Indian to do such a well thing when there is a lot of consultants are all British, and I'm doing a better aneurysm surgery than others, that was very strange to them. Anyway, so this anesthetist, he realizes that for my future career, I should establish myself well. So he said that, Robin, you take your time, do your operation properly, and I will be very patient, and you don't worry about the time, but do it well. So he encouraged me to do aneurysms, and so that the results become good. So what I used to do in those days, there was no digital angiography that much. There was, however, when I used to come to the hospital, I used to live very near the hospital. And I used to, after having my evening meal, I used to come to the hospital at about, say, 9:30, and then looked at the angiogram from various angles, because in those days there were 3-4 views, like a epilateral, orbital, oblique, and these sort of various views. So I used to look at those various views again and again and again for 2-3 hours, unbelievably, just looking at the pictures. And I was thinking, because in my opinion, in those days, I got the idea that aneurysm is just like a snake in a jungle, and it is in the base of the skull. And if you know the map of the jungle, then you can attack the snake without snake attacking you. So that is why I needed to know the map of the jungle, and by looking at the those angiograms. So after having especially the way that we used to do the aneurysm surgery in those days in a terional approach, in the terional approach, you just go through it fits in with the orbital view, oblique orbital view. And if you look through the orbital, that is the picture that when you go inside the brain, you will see that this is what you see. So this is the way I started to do, and the result has started to become well. So when I first published 32 anterior communicating aneurysms without any death, and it became a very sensation, and it came into the local, one of the very eminent newspaper, publication, and then, so it was a very interesting joke. I was asked to present the paper in American Academy meeting in Bermuda. So when I was presenting the meeting, and people appreciated it, but one of the neurosurgeon stood up. He said that he doesn't believe anything like this, but it is a black magic. And so anyway, he was, I just did not mind at all. But then I realized that although my results are good, but I knew that there is, I have got to get the aneurysm surgery properly done. So I was looking at from the publications and meeting, attending the meetings, and decided that in the meeting, people present their cases very well, but that is not the right approach. The right approach is to go there and spend a week or 2 weeks and see them operate, and then learn from there. So my wife, very helpful to me, and she said that you make your career well. Don't worry about our financial condition or anything, and you go ahead and do. So I used to travel. First time I went to go to Gustav Nolan in Sweden, and Gothenburg, somewhere, yes. And I was amazed to see that how good result he used to get by only delaying the operation and also taking care of the circle of Willis. Circle of Willis, he has a very important interest in the circle of Willis and also delay in the surgery. So he thinks the circle of Willis is the trick where the aneurysm surgery post-operative vasospasm develops or not. And so I was very impressed. And then I went to various centers in the world. I went to Harvard Mass General Hospital. Incidentally, I worked in Mass General Hospital for a year as a resident. And Roberto Heroes at that time was my colleague. He was just a colleague. And he used to invite me to his house. And I used to cook curry and he used to love it because he's a Cuban exile like me. And so he was a very open-hearted fellow. And everything that Professor Tu said is true about him, a great guy. Anyway, so I went to Mass General Hospital. I went to Mayo Clinic to see Thor Shunt, how he operates. I went to Charlie Drake. I went to any places, and then America in various places. And then I went to Europe, various centers. I went to Japan, and just to see. One place which is strike me was Professor Yeshergil. And I have got a great love-hate relation with him because he used to insult me right, left, and center because at that time, I was not using microscope. And once one of the chap insulted him saying is that you talk about microscope, but I know Dr. Sengupta, he doesn't use microscope, but get a very good result like yours. And then Yeshergil did not like it. Yeshergil said that you have come to me to learn and tell outside microscope is not necessary. I have never said anybody anything. I only went there to learn microsurgery to Yeshergil. So anyway, so he was, as you know, very whimsical person, but very, very strong believer of his own thing. So he was a master in kind of a dissection of the things. But anyway, so he was, I have a lot of stories about Yeshergil. I don't want to use the time. And he was with me for 1 month in India, all over the places. Anyway, and so I learned really the aneurysm surgery by seeing other great surgeons operating. So this is the way that aneurysm surgery, in my mind, became that you must have to learn from everybody. That's it.
Thank you very much. That answers actually my question that who had influence on your career. Now, there is a question which we may take it now. There's a question from my best friend and a colleague from Mumbai, Dr. Parekh. We trained together both in India and in UK. He asked that, is there a difference between aneurysm surgery in 1990s and now due to the change in technology? And my question along with that is that, do you think with the embolization and the endovascular treatment, aneurysm surgery is a dying art? I want to be provocative, sorry.
Yes. Well, I know that this is a very topical problem. No, I don't think so. Aneurysm surgery, it is definitely, I mean, although endovascular surgery has taken over most of there are many reasons why direct surgery of aneurysms has to be there. The reasons are that endovascular surgery is a wonderful innovation. And in fact, it was innovated from only by the neurosurgeons. If you think about the days of in the 60s, these neurosurgeons who did the first coiling, Argentinian neurosurgeon who came to Sean Mullen's thing, and then he started to do research on doing these things. So it was all of them created by the neurosurgeons. But the point is that it is innovations is the part of the neurosurgical thinking. Therefore, the fact that neurosurgeons and endovascular surgeons have become, in some part of the world, have become separated is a very unfortunate thing, because there is a place for both. Because if endovascular surgery can do the coiling very safely, that is perfectly okay. But at the same time, neurosurgeons is required for every aneurysm. Cannot be coiled, flow diverter, whatever you say. There are areas of aneurysms. This cannot be handled only by the direct surgery can do, number one. Number two, there is also a basic difference that there is a period when endovascular surgery for aneurysm is not advisable, when there is a lot of bleeding, hematomas, and there is a lot of situation. So where that have to be removed, not only aneurysm clipped. If there is a hemorrhage, then aneurysm surgery become secondary. But the saving the life by removing the hematoma is the first thing. And then so therefore, definitely there is a place where the direct surgery is absolutely vital. If nowadays, present day neurosurgeons do not know how to clip an aneurysm or open the brain for subarachnoid hemorrhage, then it is very, very unfortunate. And I think that this is not right. So it is not dying art. It is dying because the neurosurgeons are ignoring it. And I hope that they don't.
Thank you. Thank you very much. But I know that people like you, Professor Misra, Professor Tu, and others are keeping it alive. We are almost coming to an end of. I have one more question.
Pragnesh, I just want to give you some anecdotes. Like many of us people in India who have learned from Robin. I was in Edinburgh in between 84 to 87. I was a registrar there, and we used to have a meeting, Newcastle joint meeting. I don't know whether Robin would involve a joint meeting with Newcastle and Edinburgh. We used to have a joint meeting, and we used to interact. But then actually we met not in Edinburgh, but in one of the American meetings. I think it was New Orleans. We were there in 1986. Was it 1985 or something like that? I don't remember now. But anyway, New Orleans CNS meeting. So Robin, I met him there, and I said, see, I would like to come and see you some of the meetings. And he was very kind. I said, see, I'm interested in vascular neurosurgery, as many of us in my generation, because that was the cream at that time. Neurosurgery, vascular neurosurgery was very glamorous then. And so I said, can I just come and see you sometime? It's very, very easy to go from Edinburgh to Newcastle. So he was very kind. And his secretary would let me know the day before if he's operating an aneurysm or any other microsurgical like MBD. He was very fond of doing MBDs also. So aneurysm surgery and MBD surgery. So they would inform me, his secretary would inform me the day before, and the morning I used to go and see him operate and then come back in the evening, same day, after he finishes. He's a very, very meticulous and like, I think he has got some traits like Yasser Gill, because he's a tiger in the theater also. I don't think anybody dares to say anything when he's operating. Very quiet atmosphere, and he's completely immersed in his surgery. But it was such a privilege and honor privilege to have seen Mr. Sengupta operating. Thank you, Robin. And that was one of the areas which I developed over a period of time, thanks to you. And so you have contributed to many neurosurgeons, including me, in my career.
Thank you very much for that addition. That group of 4 Scottish and Newcastle neurosurgical unit meetings were still happening when I came to Aberdeen. It used to be called GANED. So Glasgow, Aberdeen, Newcastle, Edinburgh, and Dundee. We used to meet as a group. And I remember that meeting also when I came to. Coming to the last question, Professor Sengupta, what is your final message to the neurosurgeons of current and future generation?
Well, I would say that to become a neurosurgeon, one will have to, the training period is very intense. Training period is very intense. And at that time, you have got to get the ability. Ability comes from practice, and practice. There is ability is the most important thing. Number one. Number two, empathy towards the patient, because the patient's relatives. I will tell you one quick story. I was operating on an aneurysm. I did an aneurysm of a very big aneurysms in the basilar aneurysm, and the young lady died. 5 years after that, another consultant referred another young lady with a similar basilar aneurysms. So I explained to the mother that this is a very difficult aneurysm. I tell you what, there is a risk of not even surviving from the operation or very serious disability. Then she said, oh, I know all about it. She was an elderly lady. I say, how do you know about it? Then she said that you told me 5 years ago. I said, why did I tell you? He said that my other daughter died in your hand. And then this is the second daughter with the similar problem. Then I said that I'm not going to operate on your daughter. Impossible. I will not. Then she said that Dr. Sengupta, I want you to operate because I know that you are the best surgeon. And she said, and if my daughter, whatever happens to her, she should be operated by you only. And then I operated, and she died. So I could not almost face, so almost came out, and I was almost in the tears. What to say to the mother? Then mother looking at it, she did not ask, how is your daughter? That, Dr. Sengupta, why are you so sad? Something must have gone wrong, but you should not be upset. I know that you tried your best. So this empathy between the surgeon and the patients are very, very important. So you need to have ability, empathy, and also you must be honest to yourself, to your colleagues, and to everybody. The final advice I would give, which I'm not very good at it, I know that to make our career, we take all our concentration, but we should not ignore the family. We should not ignore the family, because if you ignore the family, because they sacrifice for you to become whatever you become, but you should not ignore them. This is the very important thing that I will tell.
Thank you very much. I think that with those final words, we salute you once again, and I hand over back to Professor Misra. Thank you for giving me the opportunity to share the platform with the giants of neurosurgery.
Yeah, it was a pleasure, and going back in memory lane, both with Robin and Yong Kwang. There's so many stories I have, but I can't. I mean, time is limited, so maybe some other time we'll. Thank you very much, and I'll just tell you that the thoughts are so similar. You know, Robin said that it's like a snake in a jungle. You know, one of the slides of Professor Tu, if anybody has listened to his AVM talk, he shows a cobra as an AVM. You know, AVM is a cobra. So it's a very, very similar attitude, and there's similar interests. So it's a pleasure and privilege. And thank you, Wanchu. Thank you, Pragnesh, for doing this. It's an honor to be here with you. And thank you, Yong Kwang. Thank you, Robin, for contributing. Bye-bye.
Hi. Thanks, everyone.
Thank you.
Thank you, Professor Tu and Professor Shu.
Oh, thank you, everyone.
Thank you.
Thank you, Professor.
Great listening to all you.
Thank you, Robin.
I hope we'll meet soon, because we have not seen each other for some time, some years. So
yeah, I hope so. I hope so. Yeah.
Thank you. Thank you.
Thank you, Robbie. Thank you.
I'll be in touch with you, Professor Sengupta, again. Thank you.
Very good. Thank you.
Thank you, Dr. Varade and the team. Thank you.